Thank you for that lovely introduction, Catherine. I hope I can do the next 10 minutes justice. I guess the first thing is what is Project A? So Project A is an improvement programme for ambulance services. But what it does is it tries to flip the traditional notion of a top-down or an old power approach to change that we traditionally do in the UK NHS to one that is based around bottom-up, emergent and engagement principles, very much around a new power approach. And I guess this slide says it all, really. It's about connecting with the front line and people within ambulance services and unleashing their collective brilliance around improvement. And just to give you a sense of its scale a little bit, it actually is a UK-wide improvement programme. Initially, we were commissioned just for the 10 ambulance services within England, but very quickly, Project A spread out to Scotland, Wales, and Northern Ireland. And the kind of work that we've been doing, and I'll talk a little bit more about this in a moment, has very much been around well-being, people who fall, and people responding to people with mental health crisis for ambulance services. So where did it all come from? Well, the gentleman stood in the middle there with the yellow high-vis jacket on is actually the chief executive of NHS England, a gentleman called Simon Stevens. And in the winter of 2017, things were really quite difficult in the UK NHS. And Simon went out with 2 ambulance crews, one in London and one in Stoke-on-Trent. And what he heard from those ambulance crews was a real sense of frustration about things that they knew could be done better for them as frontline operational staff, but that they couldn't get their voices heard in the system, and they couldn't make the change and the improvement that they wanted to make. So Simon commissioned Project A, and he asked Horizons to lead that particular programme of work alongside partners at the Association of Ambulance Chief Executives. And we've been doing that now for about just over 1.5 years. We've been working on Project A. So it started in June 2018, and we had a launch event in London, and all 10 English ambulance trusts, ambulance services were invited, and they came along to that event. And as I said, actually Scotland, Northern Ireland and Wales quickly stuck their hands up and said that they wanted to join in as well, so they came along as well. And that, I guess, was the initial stage of launching Project A and giving it a sense of identity and energy. And the people that came to that event were frontline paramedics and ambulance staff, or people from the control rooms and in the telephone exchanges, those kind of people. That gave us a sense of momentum and launch. And then we very quickly, over the summer of 2018, started to ask people, well, okay, what are your ideas for improvement? How can we change some aspects of the ambulance service? So we very much wanted the ideas to come from the bottom up, from the front line. And the way we did that in the initial stages was we had an ideas platform. So we effectively crowdsourced. We threw it out to the crowd. And we supplemented that with high uses of social media. And that social media, we use things like Twitter, et cetera, to get the energy going amongst the frontline staff. And I guess when we started this process, we were estimating that we might get about 200 ideas coming from that initial sort of crowdsourcing and the use of the ideas platform. The actual response that we got, to be quite honest, was staggering and overwhelming. So once you unleashed the energy of people within the ambulance service, they responded fantastically. So as I said, through the crowdsourcing platform and by using social media, we actually got, would you believe, 608 different ideas come forward from either frontline ambulance staff or people in control rooms or even members of the public. And I guess in some respects, we were a little bit overwhelmed by that and the energy and the enthusiasm that had been generated by just opening up, asking people their opinion, giving them a sense of joining in was absolutely phenomenal. And you can see here in the bubbles the various groupings of those 608 ideas. And, you know, obviously, given the high pressure environment that ambulance staff work within, there was a lot of ideas about well-being, also a lot about their own personal training and development, and about how change could be led in their particular sector. We, however, recognised that 608 ideas was probably a little too many for us in Project A to work upon, and we always had in the back of our minds, I guess, Simon Stevens' initial quote when he launched Project A, which was, actually, what I want out of this is 3 or 4 ideas that have come from the front line that all ambulance staff can work upon. So we knew that we had to get this down, and here in front of you, I guess, is the decision-making process. So this wasn't Horizons making the decisions about which of those 608 ideas that we worked upon. Again, it was open. We asked people to join in. People came from different ambulance services and helped us filter those ideas down over a couple of months. And eventually where we got to were 12 ideas that we wanted to test with individual ambulance services. So what we did is in September of 2018, we threw open, again, what we called an innovation burst or a hackathon. And that was a 2-day virtual meeting whereby we connected all 10 English ambulance trusts and the 3 countrywide services together to test 12 ideas virtually in terms of, you know, would they work and how could we implement some of the ideas that came through. And that led, I guess, to 3 improvement collaboratives and 2 spin-offs, as I'm going to call them. So the ideas that we've been working on over the last year or so. One is around responding to how the ambulance service responds to people who fall, and where that's got to is that community, that improvement community, has coalesced around some work that's been done in the Welsh Ambulance Service around launching a national falls framework for ambulance services. The second area is around how does the ambulance service respond to people in mental health crisis and emotional distress. And again, I think that's been a fascinating improvement collaborative in terms of the fact that the idea that people have coalesced around there actually arose from a shout out at an event by a paramedic who basically came to myself and just said, look, I think I've got something here. I just want to talk to people about it. So we gave him a platform at a workshop in front of, I think it was 70 odd people, and Darren, a frontline paramedic, spoke to us about a tool that he was developing. And actually, the rest of the room thought he was onto something. So we've worked quite closely with Darren in developing his tool and helping him spread that over the last 12 months or so. And also quite a lot of work going on around well-being and the implementation of something called Schwartz rounds. What I'd say about each of those in terms of falls, mental health, and well-being is that the ideas were very much there with the individual paramedics or frontline ambulance staff. And I guess what Project A tried to do was try to give them the confidence, the energy and the agency to take those ideas forwards and connect them into other people who could help them develop those. And here, I guess, are some of the examples of what Project A has done. So you can see in the top left-hand corner, that's the falls framework that I spoke about, that the improvement people have been working on around falls. We've done a lot of work around a directory of good ideas. So even some of those ideas that we haven't worked on specifically, we've held in a directory and published that. That's had over 5,000 hits in the last few months. And we've done a lot of work around curating the ambulance quality improvement network. Again, what we saw through Project A and people coming to events or joining in either some of the virtual meetings was a real desire to connect and learn and share things with each other. So again, we've curated some of the ambulance quality improvement network, and you can see in the bottom right-hand corner the first meeting of the ambulance QI network. And what we're trying to do now, I guess, is go where the energy is. And the energy for Project A at the moment has broadened away from those specific ideas around falls, mental health, and well-being. And Project A has become a much broader improvement initiative, still rooted to the front line, but it started to go into other areas as well. What we've seen, I guess, is a real desire to connect, learn and share. Traditionally, ambulance services worked within their geographical patch in the UK. They didn't talk to each other and learn and share and connect ideas around change and improvement. Project A has facilitated that predominantly through the use of virtual technologies, but also through Twitter, tweet chats, social media, etc. And we've seen Project A also starting to influence other areas of work. So the ambulance service have liked what Project A has done so far around quality improvement and change, and have started a programme recently around diversity and valuing difference. So in the top right-hand corner, you can see a lady called Pam Brown, who actually was the initiation point around that particular programme of work. And again, it's spinning out into other areas, and after Christmas, we're going to be doing some work with the ambulance service around culture and leadership. So again, the influence of Project A is sort of seeping out, I guess, into other areas and the way that it works. Project A, though, is 90% virtual. And what I mean by that is it's very difficult to take frontline staff in ambulance services away from their place of work, whether it be on the ambulance, in the control room, in the office, wherever they are. So what we've had to do is we've had to think very differently about how we approach connecting people together. And what we've done is we've used virtual collaboration as a means of doing that. So not only have we used the tool called Zoom, but we've also used Twitter, which is a great way of people having an instant response. We've used things like Basecamp, Trello, all sorts of different virtual tools to connect this community together and to give them a sense about what and how they can work on. I would go so far as to say now that the ambulance service in the UK is the most virtually connected part of the NHS in the UK, even to the point now where the chief executives of individual ambulance services are confident enough to meet virtually rather than in a meeting room together. So I think that they've come a long way. And what we're starting to see is individual ambulance services use virtual tools, whether that be Twitter, whether that be Zoom, whatever, crowdsourcing platforms, etc. We're starting to see them using those tools to develop their own initiatives within their own ambulance services as well. It's fantastic in terms of how far they've come. And just very quickly, people ask about the concepts around Project A. One thing I would say about Project A is it's incredibly relational. It's based on forming relationships and connections, and we do that by all these kind of means that you can see circled there, whether it be telephone calls, whether it be WhatsApp groups, Facebook groups we've got, there's Twitter conversations, there's Zooms, there's all sorts of different things that we use to connect people. So it's very much a relational approach. You know, it's very bottom-up, engaging and relational. It is not top-down at all. And I just wanted to end really by giving you a sense of one of the people that works within Project A. So this is a gentleman called David Morgan, and Dave Morgan is a paramedic. He does shifts still within North East Ambulance Service. In fact, he's doing several shifts this week, so he's clearly rooted to the front line, and he's also their quality improvement manager. And what Dave, I guess, has got through Project A is a real sense of himself and of connecting with others and creating the agency and drive for improvement. Indeed, Dave is probably now a classic super connector. I actually went to a conference in Scotland last week, or a couple of weeks ago, and as I walked through the door, the first person I saw was Dave. Yeah, and it just shows that actually Dave is everywhere. He's trusted by people from the front line to the boardroom. And he's got a real sense of, I guess, of confidence, energy and agency by connecting with others from around the UK about quality improvement work with ambulance services. That's a little bit about Project A.